Hello. Um, Today I will be talking about estrogen and its function in the body. Estrogen isn't just about reproductive health, it's a multifaceted hormone that influences various aspects of our physiology. And understanding estrogen is important for women of all ages as it can significantly impact their health and well being in multiple ways. During this presentation, we'll explore its functions in reproduction, overall health, and how it regulates the menstrual cycle. So functions of estrogen. Estrogen is pivotal in the female reproductive system, influencing several vital processes. Firstly, in reproduction, it regulates the menstrual cycle, stimulates uterine lining growth, and triggers ovulation. Secondly, it contributes to the development of secondary sexual characteristics like breast and pubic hair. And additionally, estrogen collaborates with progesterone to support fertility and early pregnancy. Beyond reproduction, estrogen maintains bone density, influences neural functions, regulates metabolism, boosts immunity, and it even supports cardiovascular health. The menstrual cycle is governed by a lot of different hormones, mainly estrogen being one of the most significant ones. It has three phases: the follicular phase, ovulation, and then the luteal phase. During the follicular phase, estrogen levels rise, thickening the endometrial lining in preparation for potential pregnancy. That lasts about 1 to 14 days. And then ovulation occurs around day 14, triggered by a surge in luteinizing hormone, LH, releasing a mature egg. In the luteal phase, the corpus luteum secretes progesterone and estrogen, preparing the endometrium for implantation. And if fertilization doesn't occur, menstruation begins. So that cycle just starts over again. Understanding estrogen. I'll go over the types of estrogen, the two estrogen receptors, and its metabolism. Under normal circumstances, the body produces three main types of estrogen: estrone, E1, estradiol, E2, and estriol, E3. Estradiol, E2, is the most potent and is primarily produced by the ovaries before menopause. Estrone, E1, becomes more prevalent after menopause and is made mainly in adipose tissue. And estriol, E3, is the weakest form of estrogen. But it's significant during pregnancy. Estrogen exerts its effects by binding to two main types of receptors: alpha receptors, which promote cell growth, and beta receptors, which inhibit cell growth. The binding affinity of each estrogen type to these receptors varies, influencing either cell proliferation or inhibition. Estrogen is then metabolized into 2-hydroxyestrone and 16-hydroxyestrone, which each have distinct roles. 2-hydroxyestrone has protective effects, while 16-hydroxyestrone is associated with increased cell proliferation and higher cancer risk. And then a small portion of estrogen is also converted into 4-hydroxyestrone, which may promote cancer by damaging DNA. So estrogen levels fluctuate throughout life. They peak during reproductive years and then decline post-menopause, which impacts various life stages. It plays a crucial role in sexual differentiation, which we talked about, puberty, adulthood, and pregnancy. It affects bone health, metabolism, cardiovascular health. Also went over that. Moreover, the estrogen influences factors like bowel motility, liver function, blood coagulability, and lipid profile. So it has some metabolic effects, significant metabolic effects. So in terms of nutrition and lifestyle guidelines for optimal estrogen balance, this requires a holistic approach involving nutrition and lifestyle choices. Key strategies include consuming healthy fats, fiber, phytoestrogens, and essential micronutrients. So omega-3 fatty acids are a significant portion of this diet. They reduce inflammation and improve estrogen metabolism. So diets high in fish, fatty fish, flax seeds, walnuts, avocado. And then if the diet is not adequate in those fatty foods, then it's recommended that women take 1,000 to 2,000 milligrams of EPA and DHA daily. And then fiber is also, high fiber diets are also important. They help maintain hormone balance and by preventing reabsorption of estrogen in the gut. So foods high in fiber, this are fruits, veggies, whole grains, legumes, any other foods. Phytoestrogens are a huge part of estrogen balancing diet. So these are compounds found in soy products and flax seeds, which can help balance estrogen levels by binding to estrogen receptors and modulating hormone activity. And then some of the key micronutrients are vitamin D, B vitamins, and then the minerals magnesium, zinc. Antioxidants are also recommended as they reduce oxidative stress, so they decrease inflammation. And green tea polyphenols, which fall into the antioxidant category too, I guess. Cruciferous veggies are also highly recommended. And then if the diet is not adequate in cruciferous veggies, then supplementation with 300 milligrams of indole 3 carbinol daily is recommended. And then anti-inflammatory botanicals and herbs such as ginger and turmeric, alcohol moderation, avoiding xenoestrogens, and promoting a healthy microbiome. It's also recommended to do a low glycemic index diet, which would naturally occur if you're following an anti-inflammatory diet. And then lifestyle factors such as regular exercise, stress management, and getting 7 to 8 hours of sleep every night. And yeah, that's it. So this is just a summary of the 3 main factors in optimal estrogen balance. So anti-inflammatory diet, rich in omega-3 fatty acids, fiber, and phytoestrogens. Weight management and insulin sensitivity are also very important. Maintaining a healthy weight and promoting insulin sensitivity are crucial. And healthy lifestyle habits, which include the exercise, stress management, adequate sleep, avoiding estrogens, which mimic estrogen, and are in our environment, and other lifestyle adjustments such as limiting alcohol intake and promoting healthy gut microbiome. Thank you.